Diabetes. Basic concepts explained by Diabetic Specialist Dr. Rishi Ramtahal.
Hello, thank you Dr. Sanaran for having me here today. Today we're going to talk about diabetes. So let's dive right in. What is diabetes? So diabetes is high sugar. Most patients know it as high sugar, and for all definitions, that's good enough for patients. Now, what I need patients to know is that diabetes is not just high sugar alone. Diabetes has a lot of complications. So it can affect the nerves, the eyes, the kidneys, and things like that are closely related to your sugar control. So if your sugar is normal, we could prevent those complications. But there are also other complications like heart attacks, strokes, things like peripheral arterial disease that are not really related to the blood sugar. So then we give patients things like aspirin, cholesterol tablets, and so on. And this is what we need patients to understand, that because diabetes is not just about sugar, sometimes patients say, well, doc, why am I taking a cholesterol tablet? Why am I taking aspirin? This is to prevent the heart attacks and stroke. And this is the next thing I want to focus on.
Diabetes prevention.
Patients don't understand about prevention. When you have a surgeon and you have, let's say, a gallbladder, and you have gallbladder pain, you take out the gallbladder, the pain goes away, the patients feel well. When we are dealing with patients like diabetes, it's a long-term prevention. So it's like an investment in your health. And we as doctors see this often, because if I see a patient today, right, and you're not feeling well, and you continue not taking your medications, I might see you next 6 months with losing a foot. Now, patients don't understand that this prevention aspect, they don't understand. Our role is to prevent the heart attack, prevent the stroke, prevent all the complications of diabetes, because a lot of patients, when they get the heart attack or stroke, they don't have a second chance. That's it. A lot of them die. Some of them have a second chance, but they can't walk, they can't talk. And we see patients, especially when these things happen, then they start to take control of their sugar. Then they start to take their tablets, but that's too late. What we want to do is prevent these complications, and patients need to understand that is the importance of diabetes. It's like you're thinking about an investment in your health. We want to prevent all these things, because if it does happen and then you decide to change it, if you get the chance, it's too late. It already occurred, right? So those are some of the basic concepts I want patients to understand, that diabetes is not just sugar. It's a lot of things more. And that's why sometimes patients can't just see one doctor for diabetes. They need to see a lot of different doctors, the eye doctor, the kidney doctor, the foot doctor, things like that. Patients need to understand the importance of preventing. Because I'll give you an example. So a lot of patients, when they're now diagnosed with diabetes, they're passing urine a lot, right? They're sweating, they're tired, and so on. When we get their sugars under control, they feel better and they're happy. They take their medication. But then when they get to that stage and they're feeling normal all the time, they're thinking in their heads, oh, why should I continue this medicine? I'm feeling good, because they get accustomed to that baseline. Now, we want you to take the medicine for all the reasons we just said, to prevent the heart attack, prevent the stroke, because they may not get another chance. And that's what patients need to understand. So prevention, diabetes is a long-term game. It's not short-term.
Types of diabetes.
Types of diabetes I want to discuss next, right? And this can help us if patients understand just the basics of the types of diabetes. They could kind of understand things about the treatment, because the end goal, we want patients to understand why they're taking their medications, why we're taking it for diabetes. So the type of diabetes, we keep it simple. Type 1 diabetes, type 2 diabetes. They have diabetes in pregnant patients, which we will discuss today, and they have some others that are not too important. So type 1 diabetics, for all intents and purposes for this talk, is your kids, right? Your little children. You could have an adult with type 1 diabetes, but we wouldn't go into that. Type 2 diabetes is a more common one that a lot of patients looking at this today would have. Those are the older middle-aged patients. They tend to be overweight and so on. And that is what we'll focus on. So if we start with type 1 diabetes, they have the pancreas, you have the beta cells, right? The beta cells are what are responsible for producing insulin. Basically, type 1 diabetic patients, they don't have any beta cells, so they can't produce insulin. So the treatment for these patients would be to give insulin. Makes sense, right? Type 2 diabetic patients, they still have their beta cells, but it continuously gets less and less and less and less with time. So although they have beta cells and they can produce insulin, they're producing less insulin. So you might give insulin for them, but they also have an element of what you call insulin resistance. So if the little bit of insulin they have, it's not entering the cell, it's resistant to it. So some of the medications we might use for them, we might use tablets that would increase the insulin sensitivity to make the insulin go into the cells, and they even have tablets that would increase the insulin production, so you don't have to give insulin. Those are some basic concepts. When we reach the treatment part later on, we'll discuss more. So for the basic types of diabetes, we'll just focus on type 1 and type 2. Most of you listening out there would probably have type 2.
Diagnosis of diabetes.
Right, the diagnosis of diabetes is important, and this is something easy. We have some conditions in medicine that is obscure. It's hard to diagnose. Diabetes, easy to diagnose. Simple blood test. So you could do a few different types the doctor might do for you. You might do a fasting blood sugar where you fast for about 8 hours. You can drink water. And if it's more than 126, that would be diabetes. You could do something called a HbA1c. That's a newer test, and you don't require any fasting. You just come to the doctor anytime in the day, not fasted, and if it's more than or equal to 6.5, that's diabetes. They have an older one when you take something, drink a solution of sugar, 75 grams of glucose, and wait 2 hours. If it's more than 200, we don't do that too much these days. And then if you have a patient that, let's say, have all the symptoms of diabetes, so the pain plenty, the thirsty, the losing weight, and you just do a random blood sugar and it's more than 200, that could also diagnose diabetes. So the point here is diabetes is so simple for a doctor to diagnose. So it's a very easy diagnosis.
Pre-diabetes.
Now, there's also something called pre-diabetes. And as the word suggests, pre-diabetes means before diabetes. So as we said, the fasting blood sugar, to diagnose that, it has to be more than 126 or more will be equal to diabetes. So if you have somebody 100 to 126, so 100 to 125, that's called pre-diabetes. If you have somebody 5.7 to 6.4 for the HbA1c, that's pre-diabetes. Diabetes is 6.5. Now the importance of this is, a lot of patients walk around with pre-diabetes. Now, you don't necessarily have to treat. This is something your doctor has to discuss with you. You could treat, you could use weight loss and so on. Now, what I want to stress is when you see a patient, or if one of you have a blood test like this, what your doctor needs to do is discuss and look for other risk factors. So high blood pressure, if you're overweight, we want to lose some weight, right? Things like cholesterol, we want to lower, we want to look at those things, fats and so on. Because another thing that patients don't understand, we usually have the diabetic patients, and a lot of you unfortunately will be out here like this, they have diabetes, they have high blood pressure, they have high cholesterol, they're obese. Now each of these are risk factors for heart disease, but it's not an additive thing. It's not 1 plus 1 plus 1 plus 1 is 4. It's something called synergistic or multiplicative. So it's like 1 plus 1 plus 1 plus 1 is 10. That's how important it is to control each of your risk factors. So when you have pre-diabetes, you have a sugar, you're happy, you say, okay, it's not diabetes, good. When you look, it's pre-diabetes. That's where you look for your other associated conditions like overweight, hypertension and so on, and you make sure those things are under control, right? Your glycemic goals. What this means is when we diagnose somebody with diabetes, what do we want to do? What numbers we want? What do we want to tell patients to do at home? So a lot of you will be doing what you call self-monitoring of blood glucose, right? You inject your finger, you check your sugars. A lot of time patients come, they say, but I forget the book. You can't remember the numbers. That's not going to help you or the doctor, right? If you're doing it, you either bring the machine and show us the numbers or you record it in a book. That is what will help you and the doctor. So what are we looking for? Is for numbers 80 to 130. That's in the morning before you eat. So let's say you come with your sugars and all your readings are 95, 100, 110. Then we know whatever we're giving you for your sugar, whatever tablet, insulin, whatever, it's working. If we see every day it's 150, 160, 170, that's higher than the target, which is 130. Then we know we have to do something else. Either the patient may not be taking your tablets, which we'll have to make sure the patient start taking, or we need to add something. And we'll discuss those kind of things in the treatment section, right? You could also look at the HbA1c, which we said is just a simple blood test. You don't need to be fasting. And most of the guidelines say less than 7. So if we see a HbA1c less than 7, that tells us like for the last 2 to 3 months that your sugar has been under control. So if you could do that blood test, you don't need to check your sugar every day or every other day at home. That would give us information for about 2 to 3 months. Now, we also need to talk about low blood sugar. The fancy word for that is called hypoglycemia. That just means the sugar is low. So that's usually defined as when the sugar is less than 70. But we also don't want your sugar to be too low, because when it's low, you could black out, you could get dizzy, you could get a lot of bad things, right? An elderly patient, if they black out, could break their hip, right? So we don't want your sugar to be too low.
Diabetes treatment.
So one of the last things I want to talk about is treatment. Treatment of diabetes has changed so much now, right? It's so highly individualized. So just like if you say go to a tailor or seamstress and they measure you and they take the measurements and they make it fit exactly how you want, your doctor and you could figure out something to work for you. So some of the diabetes drugs could cause weight loss, but they might be expensive. Some of the diabetes drugs could cause neither weight loss nor weight gain. It's what they call weight neutral. So it doesn't affect your weight. Right? Some of them might still cause weight gain, but they might be cheaper. So cost is a big factor, right? We could prescribe the best tablet for you, but if you can't afford it, it doesn't make sense. So this is a discussion your doctor and you will have to have, right? Cost versus weight. A lot of the diabetic patients are overweight. We don't want to use a tablet that could cause weight gain. If we could get a medication that could cause weight loss, that would be preferable. But some of them are very expensive. So those are discussions that you need to have with your doctor. Now, I want to discuss some misnomers in treatment of diabetes, right? Insulin. A lot of people are scared of insulin, right? I mean, is an injection? Yes. But they have ways to bypass that. They have newer things with tiny, tiny needles. You just press it against the skin, push a button. So you're not physically injecting yourself. You turn a dial and you'll get the dose. So you don't have to pull it up like a long time, right? So insulin is a lot of barriers to taking insulin. A lot of people scared of it because of the injection. So it's a phobia, right? The doctor can show you the easier devices to use. We've seen patients who have been on insulin and they're just on diet and exercise eventually, right? In the same way, you could take insulin and tablets at the same time. Now, a lot of patients don't know that you could combine things. So a lot of things you could do with insulin and a lot of things you could do with the treatment, because they have so many different types of medication now, injectable, tablets through the mouth and so on. But it's a discussion you and a doctor need to have. So I'm hoping that today's talk with some of these basic things with diabetes, I want to make sure that you all understand diabetes, understand all the complications, you know, how dangerous it is, and start taking the medication. Because we see all too often patients start taking the medications too late. When they get a heart attack, when they get a stroke, that's too late. We want to prevent that, right? We don't practice exciting medicine like the surgeons where the pain goes the next day after the surgery. This is with the end game is a long-term investment in your health. So I'd like to thank you, Dr. Sinanan, for inviting me here today, and I hope this is something very useful for your patients. Thank you.
So I hope you enjoyed that talk by Diabetic Specialist Dr. Rishi Ramdahal. If you want to book an appointment, please contact us at 747-5297-308-3370. We are here in Chincuna Road in Cunupia.